Next item, please.
Report from the chair.
At this time, I would like to turn it over to Dr. Hamami. There's been a few changes with our vaccination distribution, and I'd like for him to update all of the commissioners and the public as to the new plan that the county is embarking on to make sure that we get vaccines, especially to our senior population. Dr. Hamami, are you on?
I am, Madam Chair. Good morning, everyone.
Good morning.
So I prepared a quick presentation. I don't know if I have permission to share the screen, but it might be useful to walk you through a little bit of the report in terms of cases, as well as going over our vaccine. So let me know if you can see my screen. Can you see?
Yes, we can.
Excellent. Very, very good. I'm going to go quickly over some of the numbers and then spend more time on the vaccine, which I know everyone is interested in knowing more. So as far as...
Let me stop you for 1 second. I hear some
Yes.
background noise on someone on the telephone with the last 4 digits of 0934. If you can mute your phone, please. If everyone can mute your phone. Thank you so much. Okay, continue, Dr. Hamami.
So I wanted to give a snapshot of where we were at early of the pandemic in terms of cases and where we are now. And as you can see, we went through some rough times with a spike back in December, but now we're going a little bit below to where we were back in April. And in terms of the weekly cases, we are going in the right direction. The graph at the bottom of the slide shows you that between January, the beginning of this year, to last week, February 13, our cases have dropped tremendously, which means that whatever mitigation and restriction measures we have in place have been working. The same applies to the trend for the 2-week cases. Again, this linear graph is going in the right direction, which are all encouraging signs. I won't go into too many details about the demographics, but we're still seeing the same age range, around 39, 40 years on average. It is still a youth cases. The mode, which are the most repeated number, the age is still fluctuating between 20 to 25 years. The ethnicities and distribution along race and ethnicity is still similar to how we started with the pandemic. We always look at the top 10 communities that are affected, and there hasn't been major changes. It seems that we have the 10 communities, they just trade places. However, Dearborn is still the majority of cases that fluctuates between 12% to 15%. Our positivity rate has been also decreasing. This is a 3-week period. So as of last Monday, or this Monday actually, we dropped down to 4.5 while the state is at 3.6. If you remember back in December, we were at 15%. So that is also a very good thing to have. We continue to experience a robust capacity in testing sites. These are the Wayne County sponsored testing sites. As you recall, we used much of our CARES Act to have community-based testing sites. These are the 7 that are in our communities. So far, cumulatively, we have done at least between 15,000 tests. We are averaging about 800 a week, which is under capacity. So if anyone needs a test, make sure they know about the availability of those sites. We also have 2 sites that were opened a couple of weeks ago. One is in Canton and one is right at the Frank Murphy Hall of Justice. There's a trailer that is out there, and it is available for both our employees as well as the public. We continue to have the Garden City Hospital. Our cumulative tests are so far 15,000 tests, and that site is also still working. We are continuing with our inmate testing. Our positivity rate in inmates is tremendously low. We are 1%, which is absolutely amazing. And that tells you how well our conditions and our mitigation process in mitigating risk at the jail, at both jail and JDF, is working. Many of you heard about the variant, and especially the B117. This is the UK variant. There has been 10 confirmed cases in Wayne County. Yesterday, we were informed by the Michigan Department of Health and Human Services that one of those cases has been reassigned to Washtenaw County because of the place of residence of that individual. So we are now at 9 cases. What does that mean? It means that we still need to be cognizant about the precautions, the masking, the physical distancing, and all that. In terms of our health system preparedness, we are also at a good shape. Our overall hospital inpatient bed occupancy is 65%. At one point, we were teetering on the edge of 80 to 81, which was slightly alarming. But now looking at the bed availability and looking also at the mechanical ventilators in use, this is at 26%, which is a very low percentage. Now, just a disclaimer, the 65% bed occupancy are not COVID cases. This is all cases that people are in hospitals. Let's talk about vaccines now. So this is what the state has as their final or the most updated vaccination schedule. This was published in on February 4th. And as you recall, there has been 2 phases. So there is phase 2, which we are nowhere nearby. This is where anyone can go and get a vaccine. They can go to their doctor, they can go to CVS, they can go to a community center or health center or whatever and request a vaccine. Chances are we will not get there. There has been the Biden, President Biden, as well as Dr. Fauci said that this probably is going to be somewhere in mid-July, and the state is expecting the same. So we will not have vaccine available for all until probably midsummer or early fall. That leaves us with phase 1A. Phase 1A was kicked in December, specifically with the first shipment that was sent on December 18. And it was divided into 3 groups, 1A, 1B, and 1C. 1A had all the critical healthcare workers, the frontline medical doctors and nurses, the EMS, and those that are working in ERs and ICUs, and also included long-term care facilities, staff, and residents. We had our own share as the county health department to vaccinate some of those in this group, and I'll show you that on the next slide. Now let's talk about now Group 1B. Group 1B was moved as a priority along with this population of Group 1C by the governor on January 11th. That included 75 and older, but also those that are 65 to 74. So it included everybody who is 65 and older. It also included the frontline responders in public safety. These are the firefighters, the police, as well as anyone that has to respond to an emergency. It also included the educators, the school and childcare teachers and staff that work in schools, and it included the correctional staff that work in correctional facilities. That left this group, which are other essential frontline workers. These are the agriculture and food. These are the transportation. These are anyone that does not fit in those categories. And these are now scheduled to start in May. Now, this timeline is fluent, and it all depends on whether there are more vaccines, so it can be kicked in earlier, or whether less vaccines, so it might be pushed further. But as of February 4th, this is what we have. Then you have this group, which is Group B of 1C, and these are anybody that is below the age of 65 and over the age of 18, but has a pre-existing condition. These are higher in priority than the rest of the population and the rest of the essential care workers. So where do we fit, or what are we doing? What are we doing in Wayne County? We're following exactly the same priority phases. We have finished all our EMS for both dose 1 and dose 2. Those were done and completed. We have done all the long-term care facility staff and residents that were not enrolled in a federal program where they received their vaccines from Rite Aid or from CVS or Walgreens. Those are also completed for first and second dose. And when I say all, I specifically say those that want the vaccine. We know that there is a small portion, and thankfully it is getting even smaller, that are not that are not willing to get the vaccine. Priority group 3, which is labeled as the state necessary healthcare, these are all the healthcare providers that are not in healthcare systems. These are dentists, pharmacists, dialysis units, laboratory techs, urgent cares. This population is close to 25,000 in Wayne County. We have been vaccinating them as they register online, and this is in progress. In fact, this group is getting their second dose as we speak today at Schoolcraft Community College. We have done at least 17,000 of this, and we're seeing still people that are registering, but it is not, again, in bulk amounts. We have been very successful in addressing Group 1B, specifically the law enforcement and the education and correctional staff. I'm happy to say that as of yesterday, we have vaccinated all educators and school staff in Wayne County. That is a total number of 20,000. We probably vaccinated 17,000 of those, and the rest were vaccinated by either health systems or other venues. We are in communication with RISA, and all our educators and staff are now, those that wanted the vaccine did receive it. So that leaves now those that are 65 and older and 75, so seniors 65 and older. As you recall, in one of my previous reports, we were partnering with our healthcare systems, and they volunteered immediately on January 11th when this group was moved to take over this population for many reasons. One, that 70% of the senior population are already patients of at least one health system in Wayne County. They also were receiving more vaccine that the health department was receiving, and they had a system in place to get those. However, we're also aware of some of the challenges in obtaining appointments, and we're aware that the online system for some of our seniors is probably not as friendly as to others. But in the past also 2 weeks, we have seen a smaller allocation of doses to the health systems. So now that we have the bulk of the teachers and the bulk of Group 1B out of the way, then we decided to also help with vaccinating our seniors. But before I get into that, let me give you an idea about the vaccine distribution in both regions, 2 North and 2 South. As you know, we are here in Wayne County as Region 2 South. This is from the state's dashboard, the state's website. These numbers of doses are for all Wayne County. It is not for the health department. So this includes also health systems, includes clinics, includes anyone that is scheduled or is supposed to get vaccines. So this here, the green part is the city of Detroit. And as you can see, this is the total number of doses that they got. This is us, Wayne County, and these are our neighboring counties. Region North, then you have Macomb and Oakland as well. And as you can see, we are better than others, but we certainly are not at par with the city as well as with our other counties. The reason explained to us is that there is a formula for distribution that takes into consideration population of 65 and older, the number of essential workers, as well as what is called the social vulnerability index, which I will talk about in a minute. Although we are seeing a increase in our weekly allocation, but let me give you a snapshot of our allocation of doses since we started getting the first shipment. So we had something as low as 1,000 doses a week, and we had something as high as getting 6,000 a week. This is great. We would like to see getting more of 6,000 and 7,000, and at some point, although this contains a second dose, 11,000. But what would help tremendously if we are consistent, because if you get 1 week 7,000 and you want to schedule 7,000 people the next week and you end up with 975, then that is going to create a lot of challenge in rescheduling and canceling and all that. So it puts a planning. We have been very clear with the state that we want, no matter what amount you are sending us, then let's at least be consistent in knowing what we get every week. Unfortunately, and for fairness sake, the state is in the same boat. The state has been, as of last week, getting close to 120,000 only. And my understanding that this week, probably they are going to get 200,000. So we hope that this means this new plan of redistribution, or this boost of manufacturing vaccine, is going to translate to more to the state, and that means more to us. As of yesterday, on Monday, actually, we received our doses. We received 3,900 first doses of Pfizer with 2,000 first doses of Moderna. So we have currently about 5,900 fresh doses. That means we can do new people. But then we received also second doses, which are put in place and we are using. As of last week, we collect our tally every Saturday. As of Saturday, of last week, we have vaccinated 34,942 for both second and first doses at the health department. These are some of the groups, as I mentioned, that we have been able to finish or vaccinate the majority of those. These are estimates. We are still working on the accurate numbers. Unfortunately, MICR, which is the data that you enter the information in the state database, does not allow you it doesn't allow you to enter the agency or the group. It also doesn't allow you race and ethnicity, which is quite a shame, to be honest with you, because we cannot tell you of the 34,000 how many we vaccinated were African Americans or Caucasians or Asians and all that. I am pushing so hard with the state to fix that. We are hoping that we can get something, because this data is very valuable to know those that need the vaccine the most, what is their, how much are they responding to getting the vaccine. Switching to the seniors, which I know many of you want to know. So as of this week, as I mentioned, most of the seniors were being vaccinated by our health system partners. According to the MICR data, there has been at least 70,000 seniors in Wayne County that are 65 and older that have been vaccinated. This number is impressive, but it is not enough. Our estimate is that there are close to 200,000 of 65 and older that live in Wayne County. We have this number here that is close to 5,000 people that we have vaccinated as 65 and older. That is not a targeted approach. These are probably all the groups that we have done that had 65 and older. As I mentioned again, MICR filters results by age, not by agency. So this might be where it is. We have been doing sporadically seniors, and this is also where probably some of the LTCs that we have been doing. So this number reflects that. We know that there has been also new players that are vaccinating seniors. Myers, Rite Aid, that last week was contracted by the state, and it is now actively vaccinating seniors. We worked, specifically the county worked on additional sites for our seniors where they can bypass the online and literally call numbers. These 3 sites have phone numbers. One of them is our FQHC in Hamtramck. As of Monday, they started offering seniors vaccines. They're working with the senior building in Hamtramck as well. And we also added 3 sites from Oak Street Health. Oak Street Health is a geriatric health system or health clinics. They have 11 clinics all over the state of Michigan. 5 of those are in Wayne County. 2 are in the city of Detroit. That leaves 3 out of Wayne County. 1 is in Highland Park, which is also accepting now calls and appointments as of yesterday. And then there are 2, one is in Southgate and one is on the border of Dearborn Heights and Inkster. Those are going to be ready in March. We went and inspected them, and we had to keep a log of their refrigerating system and all that so they can accept vaccine. So as you can see, we are trying to diversify where seniors can get their doses and all that. But we also want to contribute to that, especially now that Group 1B, most of the essential, those that are priority groups have been done. So we're working on 3 fronts. We're working on establishing community vaccination clinics. This is done in partnership with many of you, as well as the local municipalities and senior centers. We're also looking at the independent living apartments where seniors might have some challenges with mobility. We are compiling a list, and that list is going to be coordinated with our emergency medical services and fire departments, since they know exactly where those are and where EMS and fire departments can help in reaching out to those and possibly vaccinating those. This is where we might consider utilizing that model. And then we also want to do at our established sites, whether it's Schoolcraft College or Wayne County Community College, we want to also assign senior days where people can come in and get their doses. This is a little bit logistically more difficult than the first two, because now we are asking seniors to come in. We want to ensure that because of the weather, there is no long wait. So do we put a scheduling system in place, or do we say first come, first serve? We don't want this to become a jam where all of a sudden you have 2,000 seniors that are standing in the cold and waiting in line. So this is what we're working on to make sure that this is done in a smooth fashion. I mentioned the social vulnerability index. What we have done is we divided the population of seniors in Wayne County into 4 regions. Each region would contain close to 45 to 47,000 seniors. And we are using the social vulnerability index. The social vulnerability index looks at 15 social factors that are lumped in 4 categories. You have the socioeconomic status, such as poverty rate and income and education level. You have the household composition, whether there are seniors and there are disabilities. You have the minority status, such as race and ethnicity, and also language. And finally, the housing type, and whether they have transportation or not, or that. So all this is put into a formula, and it calculates a number. That number, the higher the number, the more vulnerable a community is considered. This is how we divided the 4 regions in Wayne County. So we just color coded them just for simplicity. You have the blue region. Again, these communities are arranged by their social vulnerability index. So for example, Romulus and Wayne with 0.7 compared to 0.3 are more vulnerable than Gibraltar and Huron. The same applies to this region, which also has these groups. And again, we are taking the population of the seniors as our rationale into keeping those regions somehow allocated in the same volume. The way we are approaching this is we are starting with those that are more vulnerable. So we will choose, depending on the senior population, so we will choose the first 2 here, probably the majority of Inkster, since it has more than the others, and also a little bit of Melvindale and so forth. So that's how we are approaching our community clinics as well as our senior living as we go along. This is what we have scheduled so far. Starting next week, most of these plans and this schedule has been coordinated with the cities, with the municipalities, and our senior liaisons at these locations. So all those that you can see here are probably number 1 and 2 in the social vulnerability index of each one of those regions. So in Romulus, we will be there on February 23rd. It's going to be at the Romulus Senior Center. At Wayne, on February 26th at the Hype Athletic Center. At Inkster on the 25th, we'll be at the Robert Dozier Center. In Melvindale, we'll be there on 2 days, 23rd and 24th at Keshe Fieldhouse. In Canton, 2 days as well at the Summit on the Park. Livonia, we have given Livonia Fire Department. I mentioned Livonia Fire Department is a registered COVID-19 provider by the CDC. That means all their 92 firefighters or EMS are qualified to give vaccines. They also have the ability, the freezers, and the storage capacity to store the Pfizer vaccine. So we have given them so far 500 doses. We worked with Commissioner Marecki, and we given them 500 doses, and they are taking those. They started on Wednesday when they receive those, and they are going to the senior living facilities and vaccinating those. We are continuing to work with the city of Livonia to see what are their needs in next week, because again, they are number 2 in that region and they have a big population of seniors. We're waiting on today. We will have the final date and location for the city of Ecorse. We want to make sure that we are there. And finally, for both Hamtramck, as you know, I mentioned our FQHC is in Hamtramck, but also we have partnered with Say Detroit Clinic in Highland Park, and they have established 2 days for the 23rd and the 24th. We're working with the city of Highland Park as well as the clinic, where they are also transporting most of the seniors to the clinic, and we will be there. This is my report. I know it's been